Good afternoon, everyone. This is Catherine Willows, and this is the Baby Friendly Hospital Initiative seminar, which is the makeup from the CTG Action Institute from a couple of weeks ago. So we're going to go ahead and get started now. We're all set up. So this afternoon, we're going to be talking about the current trends and the importance of optimal maternity care. And I'm just going to go over this a little bit. We're going to breeze through this section to just give you some overview of what the trends are on a national basis as well as on a state level. And as you're moving forward and making contact with your hospitals, that will provide you with some information and some leverage around the Baby Friendly Hospital Initiative and to have more of a sense of what's behind you and where this whole initiative is actually going on a national level. It's really gained a lot of momentum in the last couple of years, and I think that this will just give you some resources and some information to help you with that information. Next, we're going to be talking about the Baby Friendly Hospital Initiative as a whole, what it consists of, its stages of implementation, and just some general information about it in terms of an initiative not only within our country, but sort of on a global level. We're also going to be speaking about the evidence for breastfeeding. And again, this is not a lot of information that I'm going to go into a great deal of depth around, but it's information that will be helpful to you and certainly resource information, again, as you're speaking to hospitals about evidence-based practices. Also, we're going to talk about action steps for initiating implementation. And here, not only are we going to be talking about the action steps themselves, but also some of the guidance that you can provide your hospitals in moving this forward. And finally, we're going to be talking about the technical assistance for support that ICAP can offer you in conjunction with Illinois Maternal Child Health Coalition. So just to get started here, in January of 2011, the Surgeon General put out a call to action on breastfeeding. And the Surgeon General, as you probably are aware, does not put out a call to action very frequently. And this is certainly the first call to action on breastfeeding ever. It is about an 86-page document in which she really speaks to the importance of breastfeeding and breast milk feeding for infants as a national health initiative. And here you can see a quote from that call to action, whereby she states that breast milk is uniquely suited to the human infant's nutritional needs, and it's a live substance with unparalleled immunological and anti-inflammatory properties that protect against a host of illnesses and diseases for both mothers and children. And again, I would really encourage you, if you have not seen this document, to pull it up on the web and proceed through it. There's a section on it specifically geared toward healthcare professionals and the actions that should be taken in support of the Baby Friendly Hospital Initiative. So again, this just speaks to the call to action. Step 7 really is the step that really focuses on healthcare providers to ensure that maternity care practices through the U.S. are fully supportive of breastfeeding. And that's an area where we really have a cutting edge right now, and we're really working with that, and again, in support of the Baby Friendly Hospital Initiative. Numerous governmental and non-governmental healthcare agencies are evaluating breastfeeding practices across our nation, and they're promoting those that are evidence-based. You've got the CDC actively working on support of breastfeeding and promoting breastfeeding initiatives across the country. The CPPW initiatives that just concluded in the Chicagoland area were very much driven by and sponsored by the CDC. Healthy People 2020 have goals with regard to breastfeeding. Certainly the U.S. Public Health Services Department is behind that. Joint Commission has their statement on breastfeeding, and obviously the Illinois Department of Public Health. We also have the provider organizations that now have statements for physicians and providers with regard to breastfeeding, and here are just a few. In 2012, just a few months back, the AAP put out their newly revised statement on breastfeeding. And in that statement, they made a shift in stating that breastfeeding and human milk are the normative standards for infant feeding and nutrition. Given the documented short and long-term medical and neurodevelopmental advantages of breastfeeding, infant nutrition should be considered a public health issue and not just a lifestyle choice. And that's a huge shift for us because we, up until recent times, we've really considered breastfeeding a choice of the mother, and there's still very, very common language in our hospitals where mothers are asked, are you bottle feeding or breastfeeding, as if they're all equal and it's an either-or type of option. And we know now with our science and the information that we have that breast milk is much far superior. So the CDC Guide to Breastfeeding Interventions include evidence-based recommendations for maternity hospitals to implement the baby-friendly steps. They encourage the education of mothers about breastfeeding. They certainly call for professional support and peer counselors within not only the hospital environment but within the community setting, and support in the workplace for mothers that are breastfeeding. Again, the Joint Commission has created their exclusive breast milk feeding as one of the 5 perinatal core measures as of April 2010. And what we know about the cost of formula feeding is that suboptimal infant feeding practices in the U.S. have resulted in an estimated $13 billion per year in excessive costs. We know that $3.6 billion per year is spent to treat 3 conditions that are preventable by breastfeeding for a minimum of 6 months. And in fact, the AAP has recent statements with regard to this that that if a mother breastfeeds for a minimum of 6 months, that lower respiratory tract infections are reduced by 72%, that ear infections are reduced by 50%, and that GI infections are reduced by 64%. So that's quite significant and a very easy preventable measure. With regard to hospitals, we know that sick babies result in higher costs. We know that approximately $200,000 is spent for each case of NEC in the NICU, and that $90,000 of that becomes hospital debt. And we know that for babies that NICU babies that receive formula feeding, that the rate of NEC is approximately 10%, where for babies that receive breast milk, it's more like 1.5%. We also know that sick babies obviously result in increased health claims, decreased productivity at work, and an increase in missed work days to care for sick children, and that when breastfeeding is not well supported, poor breastfeeding practices can lead to more hospital admissions. The World Health Organization has stated that virtually all mothers can breastfeed, provided that they have accurate information, the support of their family, the support of healthcare systems and society at large. And again, that's where we need to really come forward in supporting these mothers so that they can be successful. And there does seem to be quite a bit, a lot of myths around the fact that many mothers can't breastfeed, and that's really not true. It's really about giving them the adequate information and support so that they can be successful. The benefits of human milk extend well beyond infancy, and they impact mothers and children across the lifespan of both. In terms of evidence, formula-fed infants have greater rates of NEC, respiratory infections, sepsis, ventilator use, and SIDS. Formula-fed infants have also greater rates of obesity, developmental disabilities, diabetes types 1 and 2, asthma, and allergies. With regard to breastfeeding, the likelihood of obesity is 22% lower among children who are breastfed, and in adolescents, 30% lower. Results, and this particular number with regard to the 22% lower is actually a result of a meta-analysis of 9 studies, which was adjusted for potential and confounding factors, including maternal overweight, education, income, race, and birth weight. The risk of becoming overweight was reduced for each month that a mother breastfeeds, with a plateau reached at approximately 9 months. And again, this comes from another meta-analysis of 17 studies. For mothers, women who breastfeed have a decreased risk of multiple types of cancer, including breast cancer, ovarian, and thyroid cancer. They have decreased osteoporosis later in life, decreased postpartum depression, and certainly a decreased incidence of metabolic syndrome. As we speak about breastfeeding, you hear a lot about exclusivity. And one of the reasons that exclusivity is so important, it's not that we're trying to be dogmatic about this. It really has more to do with the fact that we see results with exclusivity that are not achieved when babies are supplemented with formula. And so exclusivity, exclusive breastfeeding for a minimum of 6 months actually protects against these major health issues that we were just speaking to, and it results in greater health outcomes. In terms of the duration of breastfeeding, exclusivity actually supports the duration of breastfeeding. So we're going to talk a little bit about the baby-friendly hospital initiatives and the steps and why they're so important. And basically, in terms of principles, the baby-friendly hospital initiative is very focused on mothers and babies, keeping them healthy and keeping them together. And we find that when we keep mothers and babies together and we get them breastfeeding in the hospital, that both mothers and infants do better in the hospital setting. Interrupting, delaying, or limiting the time a mother and infant spend together can have harmful effects, not only physically in terms of their relationship and bonding, but also in terms of breastfeeding and success. And we're going to get into a little bit more detail about that. So with regard to the Baby-Friendly Hospital Initiative, what it is, essentially it's a global program which was sponsored by the World Health Organization and UNICEF to encourage and recognize hospitals and their birthing centers for an optimal level of care in infant feeding that they provide. It includes the implementation of the 10 steps to successful breastfeeding, which are evidence-based maternity care practices which support, promote, and protect breastfeeding. The 10 steps are as follows, and you're probably already aware of these, but they include a written breastfeeding policy that all hospitals must establish, which are regularly communicated to all staff that interface with mothers and infants. They include training for staff with regard to those policies. They include the informing pregnant women about breastfeeding, initiating breastfeeding within 1 hour of birth, which includes skin-to-skin practices, show mothers how to breastfeed and maintain lactation even if they're separated from their infants. So that includes the initiation of pumping if mothers and babies are separated, no food or drink other than breast milk for breastfeeding babies unless medically indicated, practicing rooming in other words, keeping mothers and babies together, encouraging breastfeeding on demand. So that there's a distinction between on demand versus schedule. No pacifiers or artificial nipples for breastfed babies. And upholding the International Code of Marketing of Breast Milk Substitutes. You know what? Step 10 got cut off of there, and that Step 10 has to do with support for mothers and infants post-discharge from the hospital. So in other words, access to support groups and resources within the community. So I'm not sure why some of these slides are getting cut off. But in any event, the World Health Code, the WHO code, is the International Code of Marketing of Breast Milk Substitutes. And basically what it calls for is protecting mothers from from the marketing of formula companies, which can have an impact on breastfeeding and exclusivity. So why implement the baby-friendly steps? Well, basically, it's a move towards current evidence-based practices, and it facilitates the best health outcomes for both infants and mothers. And as healthcare providers, the responsibility for healthcare providers is to stay current in, with evidence and keep current with practices. So the Baby-Friendly Hospital Initiative and the Baby-Friendly Steps are a part of keeping current with current day practices. Breastfeeding success and duration are impacted by the hospital experience. We know that breastfeeding rates, initiation rates in this country are somewhere in the range of about 75 to 76%. At least that's the estimated rate of initiation or intention of mothers, that mothers state that they want to breastfeed. However, when women are discharged from the hospital, we know that those rates tend to be more in the 30 to 40s range. So we really want to help women get started with breastfeeding successfully in the hospital and to improve those rates and to improve their success with breastfeeding. We also want to support mothers no matter how they choose to feed their babies. So these practices are not just for breastfeeding mothers. Many of these practices are just good practices that are good maternity practices that support mothers with support mothers and babies in helping mothers really understand the cues of their infants, develop bonding within the hospital setting, and Skin to Skin, for example, is just very good for babies in stabilizing after birth. Many of the 10 steps are easily adapted as quality improvement projects. Incremental changes can lead to cumulative effects, and certainly the baby-friendly steps protect mothers from the formula marketing practices. There are many myths out there about what baby-friendly is or is not, and already with some of you, we've had some of these conversations on the phone, and many people think that the Baby-Friendly Hospital Initiative is about forcing mothers to breastfeed. It is not about forcing mothers to breastfeed. It's about educating mothers so mothers make educated choices, and there's a distinction. It's not about eliminating formula altogether. We recognize that there is a place for formula, and certainly there are those mothers that choose to formula feed for a variety of reasons. But what it is about appropriate use of formula, because our pendulum has swung in the direction of overuse to the point where, again, we've thrown off the success of women in breastfeeding in the hospital setting because of our formula overuse. And it's not expensive. And in fact, there was a study from 2010 that looked at the overall expense of providing baby-friendly hospital nursery services and found that it was cost neutral compared to non-baby-friendly hospitals. So now what I'd like to do is talk a little bit about the whole implementation process, how this actually works. The Baby-Friendly Hospital Initiative has 4 phases to it, and we're going to get into this in a little bit more detail here in just a few minutes, but I want you to see this graph if you haven't seen it already. I know that many of you, if you haven't met with your hospitals yet, you're going to be meeting with your hospitals and talking with them and introducing this project. And the discovery phase is really the initial phase of this 4D pathway. So we're going to come back to this, but the 4D pathway is essentially just the registration phase and getting a baseline in terms of the hospital practices. The development phase is really about laying out the groundwork in terms of plans. And then the third phase, the dissemination phase, is the phase where these plans are actually implemented. And then finally, the fourth phase, the designation phase, is where these plans are really tweaked and really, firmed down in preparation for the assessment by Baby-Friendly USA. Internationally, there are about 20,000 facilities that are designated as baby-friendly. You can see in the United Kingdom, there's approximately 13%, Australia 23%, and now in the U.S. we're up to 6%. prior to the CPPW initiatives, which occurred in many of the major cities over the last couple of years, we were down around 2 to 3% when that project initiated. So we've made some really good headway over the last couple of years. Again, this just another graph to really just depict how the initiative has grown in the number of hospitals that are baby-friendly are really accelerating. There are currently 23, actually I have to update this. In speaking with Baby Friendly USA just last week, we now have 30 hospitals designated across the U.S. There are now 800 hospitals in the United States that are in the baby-friendly pathway, which I just showed you, and that those that are designated represent about 200,000 births per year at the moment. Again, another graph that just shows the acceleration in pursuit of baby-friendly designation. And this is a map across the country that just shows the amount of growth that's occurred since 2009 in terms of the acceleration of baby-friendly. The darkened states are the areas in which there's been the most amount of growth over the last couple of years. I'm sure that some of you are aware of the CDC's breastfeeding report card through the MPINK scores. And basically, you can see that in 2011, our breastfeeding initiation rates across the country were about 74.6%. We're now at 76.9%, again, representing an increase. Breastfeeding at 6 months, 44.3%. We're now up to 47.2%. And breastfeeding at 12 months, we've also gone up about 2%. So there have been some significant increases here. We just keep inching along, which is, which is really great. In case you're not familiar with the MPINK scores, this is the CDC's Maternity Practices of Infant Nutrition and Care, and they submit these surveys to hospitals every 2 years. It's a national measurement tool, and essentially Illinois ranks 35th in the United States as of the last score. In Illinois, you can see that our data is also climbing a bit. We are now up to 76.8% in terms of ever breastfed or initiation rates. Breastfeeding at 6 months of age, we're at 49.8%. Breastfeeding at 12 months, again, we've climbed 4% over the last couple of years. Our exclusivity rates are still hanging pretty low, as well as exclusive breastfeeding rates at 6 months were really quite low. Our overall MPINK scores have gone up a little bit, and the percentage of babies born in baby-friendly hospitals in Illinois are only 1.47% because we only have 2 baby-friendly hospitals in the state of Illinois. However, I will say that in the Chicagoland area, Little Company of Mary Hospital in Evergreen Park here is very close to becoming designated. They had their assessment by Baby Friendly USA in June, and they just have some minor modifications to make, and then they will be Baby Friendly designated. In fact, Baby Friendly USA does not have to come back out. It's essentially just tweaking some of their practices, and they're good to go. So, in terms of for the state of Illinois, what the CDC recommended for us was to decrease the inappropriate usage of supplementation, increase the inclusion of a model breastfeeding policy, the initiation of mother and infant skin-to-skin care in hospitals, and the protection of infants and mothers from formula marketing. Again, we just talked a little bit about where we are here in the Chicagoland area as a result of the CPPW project that occurred in suburban Cook County and the city of Chicago. We now have 14 hospitals that have entered the pathway. Actually, we're up a little bit more than that. We're up to 16. We've got 14 in the city of Chicago and 2 in suburban Cook County, actually 3 in suburban Cook County. As we speak, we have a new entrance into the pathway as of just a couple weeks ago. And 2 hospitals in the NICHQ project, 1 in the city of Chicago and 1 in suburban Cook County. Just to speak a little bit about the CPPW project that occurred here, there were 2 projects that occurred sort of simultaneously. Again, this was a CDC project, which ICAP, along with Healthy Places Chicago and Health Connect One, partnered together in working with the Cook County Department of Public Health and the Chicago Department of Public Health, respectively. And we worked with all of the maternity centers across the area to assist these 36 hospitals in their progress of implementing baby-friendly steps and in pursuit of entering into the baby-friendly pathway. So that the Suburban Cook County project came to conclusion the end of September. The Healthy Places project is still in progress. It was due to end the end of September. However, we received a no-cost extension, and it will be continuing for a few months longer with a very sort of a narrowed focus on the hospitals that have really committed to this process. In addition, in Illinois, we've got a number of trends in Illinois that have occurred as a result of these projects, and one of which was Illinois House Bill 4968, in which the Illinois Maternal Child Health Coalition was very active in helping to sponsor and support the advocacy for. This particular bill supports an infant feeding policy, and it was passed in May of this year, and it requests that all Illinois maternity hospitals or birthing centers to adopt an infant feeding policy that promotes breastfeeding. It also requests that this policy be routinely communicated to hospital staff in OB and neonatal areas, and it requires that the policy be applied to all mother-baby couplets in the obstetric and neonatal areas of hospitals. It goes into effect as of January 2013. The Illinois Hospital Report Card now includes breastfeeding rates. It's available for consumers to actually be able to look at how well hospitals perform and how supportive hospitals are in various areas. And so the inclusion of breastfeeding rates on the Illinois Hospital Report Card will actually allow hospitals to take a look at hospitals in terms of their performance. And so as hospitals actually improve their breastfeeding rates and get more on board with these practices, and consumers are going to become more and more aware of breastfeeding as an issue here in the state of Illinois. And they're going to be looking at hospitals in terms of breastfeeding rates as they make choices in terms of where they decide to deliver. So this is, in terms of a marketing piece for hospitals, it's important for them to be able to be current and supportive of breastfeeding in maternity centers. Also, as a result of this project, what happened here in the Chicagoland area was that several of the perinatal networks in the Chicagoland area became very interested in the CPPW project as it was progressing, and as a result, some of the perinatal networks decided to encourage their hospitals within their own perinatal networks to begin the implementation of steps. As a result, this grew into a statewide initiative, and all 10 perinatal networks voted to focus on breastfeeding as their statewide quality improvement initiative for 2013. So the goal of this initiative is to make hospital environmental changes in maternity care practices to support the initiation, continuation, and exclusivity of breastfeeding milk, or breast milk feeding in all hospitals across the state of Illinois. off a little bit here on the bottom. But essentially, all hospital CEOs will be receiving a letter that has been composed by the Perinatal Network introducing them to this project. And that letter should be going out very soon, within the next couple of months. So essentially, this program, which will be a statewide initiative, includes approximately 5 steps. And so it includes, for all infants, that all infants are able to go skin to skin with their mothers for at least 30 minutes within the first 2 hours of delivery. And it also includes 24-hour rooming in and keeping mothers and babies together unless medically indicated. So that's irregardless of how the infants are being fed. In terms of protocols specifically for breastfeeding infants, it includes the initiation of breastfeeding within 60 minutes of delivery. It also facilitates breastfeeding on demand and educates and promotes. It includes the education and promotion of the benefits of exclusive breastfeeding and the support of exclusive breastfeeding by avoiding the use of routine supplementation unless medically indicated. And for those mothers who are separated from their babies, that breast pumping be initiated as soon as possible after delivery, or at least within 6 hours of delivery. So those are going to be the minimum standards for all of our hospitals across the state, starting in January of this year. And for you all, the hospitals that are, your hospitals that are actually taking on the Baby Friendly Hospital Initiative, this is sort of the bare minimum standard. You're going to be going above and beyond this with your hospital. Also, with regard to the current trends in Illinois, here at ICAP, as a result of the CPPW project, we created the Illinois Physician Statement on Breastfeeding. It was an ICAP-led initiative in collaboration with the other provider organizations here in Illinois. This was an unprecedented statement on breastfeeding. We spoke earlier about the fact that all of the major provider organizations have statements on breastfeeding, but never before has there ever been a collaborative statement. And never before has there been a statewide statement. So this is quite unique. It focuses on continuity of care from preconception to the point of weaning, and it advocates for the Baby Friendly Hospital Initiative in Illinois. You can access this through the ICAP website. And certainly it's available to be disseminated at your various hospitals for your physicians. The information on it is evidence-based research, and it has not only practice recommendations for physicians, but it also supports the advocacy of breastfeeding. So that just kind of gives the lay of the land in terms of, some of the evidence behind you, some of the resources that are out there, some of the initiative on a national scale. That in terms of implementation for yourself and getting this up and rolling, the first thing that I would obviously recommend is to really familiarize yourself with the Baby Friendly Hospital Initiative and their resources. Certainly going to the Baby Friendly website is a great start in terms of beginning to get an idea of what this process entails, and specifically around getting familiar with the 4D pathway. From there, you want to develop your work plan and your action steps and a timeline that corresponds. The next piece is to outreach to your CEOs and to obtain a letter of support from them, and being able to really share with them some of the information around what this Baby Friendly Hospital Initiative is about, the fact that this is the trend that hospitals are taking to really upscale their maternity practices, and that it actually is a good marketing strategy for them, because it will keep them on the cutting edge in terms of current practices and consumer and support of consumer needs and demands, as well as keeping babies healthier. The next piece will be identifying lactation and maternity center leaders. And I can tell you that these are your gatekeepers. These are the people that you really want to start making inways with in terms of the people that are going to help you lay the groundwork for this. So really finding out who they are in each of the different hospitals that you're working with, what their perspective is with regard to breastfeeding, and what their concerns are. Then what you'd want to do is to meet with them to introduce the project and invite their participation. So again, talking about the project itself, talking about potential funding that might be available or what their resources are, and the rationale for implementation. Again, national trends in the 4D pathway. I also want to talk a little bit here about the discovery phase and looking at some of the work plans that you've compiled. I think that there might be just a little confusion between the discovery phase and the development phase, so just to bring some clarification to that. The discovery phase is actually pretty quick and pretty easy to get through. It really just consists of the CEO letter, and I believe that you've received CEO letters from many of your hospitals already as part of the initiation of this project. So you don't need to have a second one. It also includes the completion of the baby-friendly self-assessment tool, which is going to give you a baseline of how these hospitals are practicing, and which is not only important for your information for an evaluation, for evaluation purposes, because you'll want to take a look at that again at the very end of this process, but also in terms of hospitals getting a sense of just where they're sitting with these practices, because many hospitals really, they may have a sense of what they're doing or how they're practicing, but until you actually get them to really look at this more specifically, they may be off in their perspective. So this will really help them also in terms of, as they move forward with implementing some of these changes, be able to get a sense of how they're progressing, and it will help them with their data collection down the road. And also the baby-friendly registration form, which is essentially a one-page registration form that's really pretty simple to fill out. There is no fee to enter into the discovery phase. Once in the discovery phase, then, everyone's basically reached that point, then it's movement into the development phase, and that's where the fee structure actually begins. As of July of 2012, just a couple months ago, the fee structure has gone up just a little bit with regard to the 3 phases. The development, dissemination, and designation phase fees are $3,000 for each phase. However, if a hospital has less than 500 births, the fee schedule is $2,200. So in entering into the development phase, then a hospital would submit their intent to enter into the development phase and submit their fee. In return for that, they will get a very sizable packet from Baby Friendly USA, which will help guide them in terms of the activities for the development phase. So if you go back to that slide, which shows the development phase, I'm going to just scoot back here for just a second. To the pathway. We can speak a little bit more specifically to this. So once hospitals actually get to the point of being ready to enter into development, that's when you really want them to begin to convene a multidisciplinary breastfeeding committee. And that committee is going to be very critical in terms of moving this process forward in the hospital. And you will be very active in informing that committee, and you might even choose to attend those committee meetings. In fact, I would highly recommend it. You definitely want a breastfeeding multidisciplinary committee. from the standpoint that you want representation not only from the various areas of nursing, such as L&D, NICU, a postpartum, any outpatient clinics, that sort of thing, but you also want representation from your various disciplines. So you want OBs on board, you want pediatricians, you want midwives and family physicians, and administrators on that committee. Now, that doesn't mean that everybody will need to attend those committees for every meeting. There may be some that will just come in for certain meetings and not be actively involved in all aspects of this. But you will want some leadership here that is ongoing and some people that are your regularly attended members. You will also most likely, depending on the size of the hospital, want members of the committee that will split off into subcommittees as well, in which, so for example, if you have a subcommittee that's really just a small aspect of the committee that's working on the breastfeeding policy, for them to be able to engage in activities outside of the regular committee meetings and then bring that information back to the larger committee on a monthly basis. So the breastfeeding committee should be very comprehensive, and it should interface with local WIC offices as well as local clinics and outpatient practices as need be for your particular hospital. Once the committee is convened, then it will be important for you to, the next two major activities will be really constructing a work plan for that hospital, so really helping the hospital, really identifying what they need to do to start putting this together and a timeline for it, and also working on the breastfeeding policy. That will entail getting a sense of what their current breastfeeding policy or their current breastfeeding practices are if they don't have a breastfeeding policy, and that's where that self-assessment tool will be very helpful. And then also beginning the construction of the work plan. Part of that work plan is also going to entail the training aspect. So you're going to be looking at staff training not only for nurses, but also for physicians. Baby Friendly requires that nurses have approximately 20 hours worth of training. 15 hours of that should be didactic information that cover some very, very specific points that are outlined on the Baby Friendly Hospital website, and then approximately 5 hours of clinical time, which can include like a skills lab area. Physicians need about 3 hours worth of basic breastfeeding education information, which can also be done through webinars and online educational programs. And at the end of this program, I'm going to provide you with some resources that you can pass along. The other piece that's going to need to become activated during the development phase, it has to do with the data collection plan. And again, you know, when hospitals get their self-assessment tool up and rolling, it's going to provide them with a baseline of what their practices are. Then they're going to need to figure out some way in which to track that information on an ongoing basis. So for example, skin-to-skin activities. You know, they're going to want to start to chart that and be able to track the rates of normal deliveries going skin to skin, and then as that moves into not only vag deliveries but then C-section deliveries, you know, be able to track skin to skin rates there, and just that aspect alone. Most likely these hospitals will see some impact on their overall breastfeeding rates as a whole. But moving forward, you know, it's not going to be just the skin-to-skin rates, but it's going to be exclusivity rates, rooming in. You know, the data collection and the breastfeeding policy really need to reflect the 10 steps. And then finally, once these plans are all figured out, laid out, you've got a timeline all in place, then you'll want the hospitals to apply and move into the dissemination phase. Again, a fee will be charged to move into the dissemination phase, but that will be the activation phase of all these plans within the hospital. when it comes to the development phase, the dissemination phase, and the designation phase, basically hospitals will have a year from the time of entering into that particular level to complete that phase. If they go past that year marker point, they will be charged again for that phase, for the continuation. So you don't want them going beyond a year in any particular phase. They should be able to pretty much complete it within a year's time as well. And then finally, once everything is pretty much in place, then it'll be moving into the designation phase, and that will be really making sure that the data collection is really on board, that the activities are really lined up, and that they're really getting prepared for the baby-friendly hospital assessment. So that's the 4D pathway. I'm going to move back down through the slides again, back to the slides which we were talking further about implementation. So the other point, obviously, is that you don't have to figure this all out by yourself. The fact that ICAP has just gone through 2 years of this work with the Chicagoland area, we've got a lot of information and a lot of resources that we've created along the way that we can help guide you as a result. And so just, just a few things that we've learned through our work here in the Chicagoland area, and some tips that I can provide to you. First of all, CEO and upper administrative buy-in and their support is critical to the success of this initiative and can really help carry the momentum from the top down. And we certainly have seen this with some of our large hospitals in the Chicagoland area where, they've been a little slow to get, a couple of them come to mind have been a little slow in getting started with this project. But once they got upper administrative buy-in, boy, the organization that occurred as a result was very, very significant. ICAP is obviously a physician-provider organization, and one of the areas of focus for our work here has been largely around physician engagement and physician information in this project. And what we know is that physicians play a very significant role in this process. If they're not on board, they certainly can obstruct the progress of the initiative. But if you can find some champions within hospitals, not only will they help further the work, but they will also have an impact on their colleagues. The other thing is that physicians obviously have a certain ear of the upper administrators, and that can be very, very useful as well. So identifying your champions at hospitals will be very key in this process. Also, your lactation and nursing leadership, they're the groundkeepers here, and they're the ones that are going to be really going to be activating and implementing these changes from the ground up. They're going to be laying the groundwork in terms of the praxis changes and the policy changes. So obviously getting their engagement, getting a relationship built with them, and starting to work with them and providing them with support is going to be critical. And then obviously participation from all areas of maternity nursing is essential. So you've got everybody on board. Engagement, education, and training of staff and providers is critical. Once you just getting them going in terms of understanding these principles will help them move forward. Local support has an amazing impact on this process. And so the fact that you're available, you're there to support your hospitals, you know your hospitals, you know how they're structured, you're familiar with how they work in your communities, that, your presence with this is very, very important to their success. And obviously the other piece that we've learned here in the Chicagoland area is that collaborative approaches offer tremendous opportunities for group technical assistance and education. One of the things that we created here in the Chicagoland area was the Hospital Breastfeeding Council, which was a forum in which we invited our hospitals to meet on a monthly basis, and we provided education and support in these meetings on a monthly basis. The forum has been very, very well attended over the last couple of years. In fact, the council has decided to continue forward, even though the project has is coming to conclusion. And there's been a lot of discussion around the restructuring of it so that they can keep it alive. But there's been just so much networking, sharing of information, and it's, you know, different hospitals have different strengths and attributes that they can share best practices with each other, and by you know, sort of the flip of the coin, there are many hospitals that struggle with certain practices that you know, they can get ideas about how to move forward and break through some of those barriers. So it's collaboration and providing webinars or group meetings in which to discuss some of these issues can be very, very successful. So in terms of our support to you, essentially what we can do is assist you with your work plan development. We can help inform your teams with regard to the baby-friendly steps and the implementation of the 4D pathway. Here at ICAP, we can provide you with webinars and implementation information and aid you with the implementation and your hospitals with the implementation process. We can provide presentation and educational seminars to your nursing leadership, physician providers, and decision makers from a distance if you would like. And we can certainly provide ongoing technical assistance to you to help you problem solve, to help you with your strategic planning process, and to assist you with sort of the quality improvement collaboratives and with resource information. This slide just provides you with, again, some websites with some great resource information that's available out there. Obviously, I mentioned the Baby Friendly Hospital, or the Baby Friendly USA, and their website with all of the resources that they've compiled. Here in the Chicagoland area, Healthy Places Chicago, which was part of the Chicagoland project, compiled a list of resources that we basically put together as a result of the 2-year project here. We've got many, many resources. We've got some toolkits and templates that we've put together as a result of this project. And so you can access some of this information on this website for your use and for the to be shared with your hospitals. The New York Department of Public Health has a great website with regard to resources for hospitals in implementing the baby-friendly initiative. During our project with the CPBW project here, New York actually provided us with some mentoring to help us get up and going, and so I definitely value the work that they've done in the area of putting together some toolkits to support the Baby-Friendly Hospital Initiative implementation. So I think they are a great resource. And then here at ICAP, we do have the Illinois Physician Statement on Breastfeeding online, as well as a couple other videos that we've had that actually came as a result of our HBC meetings here. One had to do with working with physicians around the implementation of baby-friendly principles in the hospital setting. We had a physicians panel in which we invited some of our physician champions to share some suggestions about how to work with physicians. We also have a video on systems change with Dr. Bill Gordon, who is a specialist in that arena, to talk about how to actually the whole process of change and the various ways that goes through, and some suggestions about implementing change. And then this webinar will be available via our website as well in the very near future. So So that's it, and this is my contact information, so should you have any questions, please feel free to email or call me, and I would be happy to assist you and talk with you any further about some of this information. I hope you all have a lovely day, and certainly if any questions come up, please feel free to email me. I look forward to connecting with each of you and helping you forward with this work. So congratulations, and look forward to speaking with you soon.